Do you do a lot of nasal surgery?
I do. One of the reasons is I'm both E.N.T and plastic surgery. I think there are 3 of us in Atlanta who are fully board certified in both. And the nose really has 3 problems. One is the outside, the cosmetic, what's called the rhinoplasty, which is traditionally plastic surgery. And then the 2 inside parts are the septum. You've heard of nasal septal reconstruction or septoplasty. That's that piece of cartilage and bone that divides your nose in the right and left sides. That's traditionally E.N.T, and I fixed that too. And then there's the sinus problems. That's traditionally also done by the E.N.T or the otolaryngologist. And I was here at Hopkins when that was the current standards were introduced in the United States from Austria back in the 1980s. So I've been keeping up with these because it sort of goes together with my training. So that's why I like to keep up with the latest, which is the balloon sinuplasty. But at the same time, I get patients who want all 3 done together or separately. So I commonly get patients who want rhinoplasty, need their septum fixed, and have sinusitis at the same time. And I'm uniquely qualified for that. The other people have to get usually the E.N.T and the plastics to work together, so you get 2 doctors, you try to coordinate it, and then there's always sort of difficulty going to 2 doctors' offices.
If you're going to get a rhinoplasty or nasal surgery, would you say look for a board-certified plastic surgeon? Also, that it's double boarded in otolaryngology or ear, nose, and throat?
That certainly makes it simpler. And you have
a bias? Do you think that that's what they should look for? Go ahead.
I'm just worried the other guys are going to get upset.
But is that what you believe?
Yes, I think you have more training in that than anyone else because you've studied it in both entities.
I've had plastic surgeons on this show that off camera they say, Randy, I don't like doing noses. They say it's a very difficult procedure. And not a lot of guys like noses. Is that true?
That's true. Noses are very hard.
Why do you like them?
Because they're very hard. I like doing small, delicate surgery and shaping. That's why I do a lot of noses and I make ears. That's another specialty I have. And both of those are very difficult. It's fine, delicate, little surgeries that just appeals to me.
Is it more art, more science?
Well, it's a combination of art and science. And that's, when I was 10 years old, I decided I wanted to be a plastic surgeon just for that reason. So I looked for things that were difficult to do and sort of went to E.N.T at Johns Hopkins, which was very good, and Stanford plastic surgery, and then to a fellowship in Paris, France, and 2 years in Oxford in England to do all this. And I'm very happy, I love it, and this is what I want to do. So I'd like for people to know, though, that this opportunity of this new procedure, balloon sinuplasty, is available because it's such a big improvement over our prior procedures.